Hello again, everybody. This is Dr. Keely Boyle with UBMD Orthopaedics and Sports Medicine in conjunction with Niagara Falls Memorial Medical Center. If you haven't met me yet, I am one of the hip and knee replacement surgeons that has recently joined UBMD Orthopaedics, and I'm very excited about it. This educational video is also being done in conjunction with Dr. Scott Nadzo, and as I mentioned, Niagara Falls Memorial Medical Center. We have launched a joint replacement program for which Dr. Nadzo and myself are seeing patients in Niagara Falls. Currently, Dr. Nadzo has already been seeing patients in Niagara Falls, and I will be returning to the Buffalo, Niagara Falls area in August, and I will be starting to see patients at the end of August, September. So please call 716-204-3200 if you would like to make an appointment with Dr. Nadzo or myself, and we can give you that number again at the end of this short educational session. So we've done a couple videos. A recent video that we did was on total hip replacement. If you have not seen these other videos, they're great little educational pearls, or may answer some questions that you have regarding total hip replacement or total knee replacement. One of the videos that we did right before this one was on total hip replacement. So this video is sort of to answer more questions that you may have regarding your total hip, or if you're considering a total hip replacement, or considering calling for an appointment for Dr. Nadzo or myself. So we are going to go over 3 more questions today to hopefully answer some of the questions or concerns that you have. So the first question is, how long will I stay in the hospital after total hip replacement? You will likely stay in the hospital for 1 or 2 days. So that means you will stay overnight, 1 or 2 nights in the hospital. So you'll either be discharged the day after your surgery, or maybe discharged 2 days after your surgery from the hospital. So this all depends on many different factors. Your rehabilitation protocol and your discharge process depends on how fast you progress with physical therapy in the hospital. And this is all highly dependent upon your condition before your surgery, the age of our patients, and any pre-existing medical problems that you have coming into the total hip replacement, all of which can affect rehab. So a safe discharge plan will be arranged for you by the orthopedic team at the hospital, and also Dr. Nadzo and my orthopedic team as well. We all work together with the physical therapists and a lot of the personnel at Niagara Falls Memorial Medical Center to make sure that the discharge plan is safe and is a good one for you. Another question that you may have is, how long does it take to recover from a total hip replacement? So the majority of people that undergo total hip replacements are able to participate in the majority of their daily activities by 6 weeks. So by 3 months, most people have regained much of the endurance and strength that they lost around the time of surgery. And most people can participate in daily activities without restriction at this time. So again, that's usually around the 3-month mark. Everybody is different. We use that as a very soft kind of benchmark for the majority of our patients. So while daily activities have resumed at this time, it is important to avoid, if you can, high impact activities to give you and your new hip replacement the best long-term outcome. Now, that being said, there's lots of patients that would like to perform activities or recreational activities that we would consider high impact. And usually Dr. Nadzo and myself are fine with that, but it's really important that you talk to us about those types of activities you would like to get back to doing after your total hip replacement, so we can make sure we account for those, those patient wishes for each particular patient. And the third question for today is, when can I walk after surgery? We get asked this question all the time. You know, it's painful when people have hip arthritis. It's incredibly painful to walk sometimes. Sometimes it may even feel a little bit better to get up and start walking, but then after a longer walk, it hurts. And then there's all these other things that, really are difficult before hip replacement surgery, or when you're thinking about hip replacement surgery, putting on your shoes and socks, all these different activities. So in the office, we get asked quite a bit, when can I walk after surgery? So Dr. Nadzo and myself And most other surgeons and hospitals today emphasize getting out of bed quickly. So a lot of the times this means getting out of bed the same day as surgery. So you have your surgery, a couple hours later, once you're feeling well and you're recovered for the most part from the recovery room, the physical therapist would like to get you up and get you moving and walking, or we call ambulating, right away. So early ambulation has been shown to reduce the risk of postoperative blood clots, and it's an important part of your recovery. Progression to using a cane or nothing at all typically occurs within the first month or two after surgery and depends on each individual's progress. So most people are walking with the assistance of a walker on the day after surgery. So I talked about the progression to a cane. So your progression to a walker and a cane, a lot of that has to do with safety and balance and some other things, but that's largely going to be determined by your physical therapy team that's working with you, both in the hospital and during your recovery process. So again, you can progress to a cane or nothing at all, and this typically occurs in the first month or two after surgery. So despite the rapid progression to moving without assistance, again, it's typically not recommended that you return to sporting activities until about the third month after surgery. But Dr. Nadzo and myself are happy to take each one of your concerns about recreational activities to each unique patient, and we can talk about when we may allow you to go back to those certain activities if that's a concern for you. So those are the three questions for today. I hope that I provided you with some information that maybe you didn't know prior to deciding whether you're thinking about a total hip replacement, or whether you're just even thinking that your hip hurts and you're not really quite sure why. Dr. Nadzo and myself are happy to see you. We'll see you in the office in Niagara Falls. We'll examine you, examine the hip. We'll get some x-rays and see what's going on inside the hip, and hopefully we can help you. So if you'd like to make an appointment with us, please call us at the UBMD Orthopaedics offices, 716-204-3200. And again, Dr. Nadzo and myself are with UBMD Orthopaedics, and we're partnering with Niagara Falls Memorial Medical Center to launch a joint replacement program.